Over 7,000 charities and voluntary groups have written an open letter to the Chancellor, warning that the national insurance increase will cost them £1.4 billion and will have a devastating impact. Now, at this time of year ahead of Christmas, many charities, including hospices, are trying to raise funds. And I know that the Chancellor did not go into politics to be the Grinch who stole Christmas for charities. So will the Minister please look again at this and exempt charities and voluntary groups, including hospices, from this cruel increase in tax, which is sucking up goodwill and donations and really, really hurting valuable charities?
Mr. Speaker, well, he was a government minister, so he had plenty of opportunity to change the system if he wanted to at the time.
So funding is welcome, and I welcome the Minister's commitment today. Will she commit to exempting, will she be able to explain whether the increase that she's announced today will cover the NIC hike for hospices and indeed the increase in living wage that was announced at the budget? And will she commit to providing future settlements in a timely manner so that hospice managers can budget effectively for the coming year?
Minister.
Well, I thank the Honourable Lady for her questions, and I thank her for welcoming the announcement, as she will know that in the last 14 years that the sector has been neglected like the rest of the NHS and social care system. As we have repeatedly said, to govern is to choose. We have improved the settlement for the health sector this year. This is a welcome announcement that can be used by the sector to manage some of those pressures and deliver the sorts of services they want to do for the future.
Josh Fenton-Johnson.
Thank you, Mr. Speaker. After the confusion of yesterday, I welcome the fact that further details on hospice funding have been announced, albeit by dragging it out of the government on the very last day of Parliament. On the 30th of October, the Chancellor decided to break her election promise by increasing employers' national insurance contributions and reducing the threshold at which employer contributions are payable. It was later confirmed that hospices would not be exempted from this increase in costs. Now the government has announced new funding for the sector, which they have the audacity to call the biggest investment in a generation. Let us be clear what is going on. They are taking millions of pounds off hospices and palliative care charities and then think they should be grateful when they give them some of it back. This is socialism at its finest. We will look more closely at the level of funding announced today, but the government has refused today, despite many questions from honourable and right honourable members, to give any clear answers on how much their tax rises will cost hospices. So I'll try again. Can the Minister please tell us how much they estimate they will raise from taxing hospices more? Was an impact assessment ever produced on how hospices will be hit? And how will that affect the care they provide? Do they expect the funding they've announced today to cover the additional costs in its entirety? At the heart of this discussion are charities providing compassionate care to terminally ill people in their final days, weeks and months. While hospices were left without information, Hospice UK reported that 300 beds have already closed, with many more to come. Does the Minister accept any responsibility for this? Ultimately, it's patients that will pay the price. And while we welcome this update for hospices, when will the Health Secretary come forward with more details on the many other health providers that are hit by Labour's tax increases, including GPs, community pharmacies and dentists? Will they be expected to be similarly grateful for getting back some of the money they've had taken from them?
Minister.
Well, Mr. Speaker, to govern is indeed to choose. The party opposite neither chose this sector or any other health sector, and they refused to govern. Within 5 months, we have not only increased the funding to the health sector to stabilise it, but we have now announced this today. I think beneath all of that, there might have been a welcome for this announcement, but I'm not entirely sure there was. Whereas the sector itself are pleased to have this money. The Chief Executive of Hospice UK said that the funding will allow hospices to continue to reach hundreds of thousands of people every year with high-quality, compassionate care, and that they look forward to working with the government to make sure everyone approaching end of life gets the care and support they need. The Chief Executive of Haven House Children's Hospital said it's very positive to hear about the government's plan to invest significantly in the wider hospice sector, and we hope there will be flexibility as possible to determine locally how this new money is spent. This is an important issue for many honourable members, and we look forward to working with the sector in the new year on the specifics of that announcement.
Clive Bethel.